You can't replace part of the brain. Like, you
treat them the same.
A source of truth for the medtech industry.
Coexists with the province.
Robot understands things automatically.
Number one show in the medtech industry.
So Stryker got ahead of that and changed it. In the 90s, built $1 billion company that held up high. A lot of things.
State of MedTech. With your host, Omar and Khateeb.
Hey everybody, welcome back to the show. And this episode is actually done in person at the Vive conference. Vive is a really well-known conference that's partnered with HLTH, and it is known for digital health. So it's a great conference if you're looking for digital health and SaaS. I saw a lot of great companies there. One of them was TytoCare. TytoCare is a home smart clinic where essentially they send patients a kit that has a variety of different tools in it for them to use in self-examination while being guided by a doctor through telemedicine. I think it's a really interesting company and a great product and really the future of medicine, because post-COVID, we've noticed that many of us prefer more intimate environments. We don't want to go to those large health systems. So we've gone to ASCs, private offices, and as much as possible, we want to get care at home. And so TytoCare is the one that enables that. And joining us from TytoCare today is Joe Brennan, their VP of Sales. So in this episode, we talk about TytoCare, Joe's sales experience, and more. So I hope you enjoyed. Now, let's get on to the episode.
Hey everybody, welcome back to the show. We're coming to you live, or I guess this is recorded now, from Vive Healthcare Conference 2024 up in Los Angeles. I'm joined by Joe Brennan, VP over at TytoCare. Joe, thanks for joining us. How are you doing today?
Excellent. Appreciate the time.
Hey, and I appreciate you showing me where this place was earlier because I was having a hard time finding it, you know?
It's a maze. I think they do that intentionally.
Absolutely. So, you know, I knew about TytoCare actually pre-COVID when they're really getting started as a company about this idea of delivering better care for patients at home. But for the listeners who are just getting to, to know TytoCare, who is TytoCare and what do you guys focus on?
TytoCare at its essence is a solution that enhances virtual care. So to your point, Tyto's been around since 2014, received FDA clearance here in the United States in 2016, but there are limitations to a traditional video visit. You can have a conversation, you can talk about what's wrong with you, but it doesn't have the same clinical quality that an in-office visit has. And TytoCare provides that for you through a diagnostic device. Yeah. And so if you had to sum up what TytoCare is, it's enhancing video visits to make it comparable to what it's like seeing someone in person.
Yeah. Let's start, and I think what's interesting these days is, and I think COVID was a big part of it, is this push to do things outside of the hospital. So there's a lot of push to do things within the acute care setting, within the physician's office, ASCs, and then even more so in the patient's home. What's the current problem with how video care is done today?
Well, I think if we take a step back, telehealth was growing slowly.
Very slowly.
Very slowly.
Pre-COVID, yeah.
Pre-COVID. But all of a sudden, 2020... the world then understands what telehealth is. And health systems, providers, payers, everyone was required to do something. And it became commoditized. You had to have some type of virtual care offering, albeit some good, some bad. But it set the expectation with patients to say, I don't have to go in for everything. I can do a lot of this at home. But the reason that we saw utilization skyrocket and then essentially go back down as low as it was before COVID, is because you don't have the capability to do the things you do within the four walls of a clinical space. So good for behavioral health, I'll have a conversation with you, but when you need to listen to someone's heart or you need to look inside an ear, you can't do that. And so Tyto fits in when we talk about what is the next iteration of telehealth. Video visits, asynchronous messaging, very good. But what does this look like in the next iteration of bringing care into the house?
Got it. Yeah, and I think one of the most important parts when it comes to the patient encounter is, of course, the physical examination, eyes, ears, mouth, so on and so forth. With TytoCare, you guys have a very nice, well-designed package that gets sent to the patient's home. Talk to us a little bit about that technology.
So you receive a kit, and it's funny, they actually designed the kit that it sits in to look like an old medicine bag, because we're bringing back the
I was wondering, because I saw that. Cause my dad has one of those and gave me it, and I was looking at it. That's okay.
It's a small, sleek version of what that is, but you're bringing the house call back. And so it's this small kit. You put it in your linen closet when someone in the family doesn't feel well. You bring it out. You connect it to your smart device, whether it's your phone or your iPad, and you can go through a full examination. You can do it asynchronously. So if you think of a parent at 3:30 in the morning with a child who's tugging on their ear, you can do that ear exam at 3:30 in the morning, send it up to the cloud, and the provider can look at it when they come in first thing in the morning. But then obviously you can also have a synchronous visit with a provider who can guide you into what they want to see in order to make that informed decision.
Got it. And so for the kit, how does it work? Does the patient purchase it, insurance coverage, and is it something that just lives in the patient's home, and then when you need something, you use it?
There are multiple models out there. We have some insurance companies who will provide it to their members at no cost. We have some health systems that will give it to their patients at a subsidized cost. And we actually do sell at retail within Best Buy, so someone can go in and purchase it that way.
Oh, really? How much does it cost at Best Buy?
$299.
Okay.
The challenge in that is that it's not directly affiliated to a health system. Mm-hmm. And I think another lesson learned from COVID is that healthcare always ends up local. So you can go to someone who provides care in all 50 states, but if it does need to, if you need something else besides that immediate care, it's helpful when it's local. So our relationships with health systems and insurance companies that can send someone somewhere else as things expand, that's very helpful.
Interesting. What's been the most common use case for TytoCare in the home? Is it mainly with people's kids? Is it with geriatric patients? What's the common use case? Or, as I like to say, the bread and butter of the business?
Bread and butter is still the low acuity primary care. And that's what video-only telehealth was. But I think where we have an advantage is that those 25 or 30 acuities that most video visits are, because you now have that diagnostic exam, it expands it significantly. So we did a study to see how many ICD-10 codes could you do with a Tyto device versus traditional video-only telehealth, and the expansion was about 60%. And so when you think of, okay, we could do these primary care issues, but now with Tyto we can do these. And because you have the ability to listen to the heart and lungs and abdomen and look inside the ear, we now have capabilities for specialists to do what they do and not necessarily just have a conversation or a post-op or a follow-up to say, hey, just making sure you're okay. They can actually listen to that heart.
Interesting. And so essentially that kit that you guys have, which is really well designed, and it is like a little video screen that connects to different pieces. So you're able to look in the ear, look at the nose, look at the throat, listen to different places, because I'm guessing there's a stethoscope that's within it. Okay? See your primary care. If something seems abnormal, you're able to route, and that could go, let's say, to a specialist who can also check on that patient, remotely, to go through that patient encounter and that physical. Is that correct?
It is. Well, it's up to the health system or the provider to determine that pathway. But because we're recording that heart sound, or where we have a video of the inside of the ear, we have a video of that tympanic membrane.
Specialist.
So when a specialist comes in, it's not I heard this, you should have a conversation with them. It's, hey, actually listen to the heart sound. Tell me what you think. Should we get this involved? So the enhancement of communication provider to provider is significant because of Tyto.
It's interesting because I like that it's an interesting model, because I think one of the biggest issues in healthcare, if you think about it, not everybody's young like us, and in good shape and good health. But a lot of times, it's the timeline of healthcare and the efficacy of which the patients get treated in. And so a lot of times if somebody's diagnosed something in primary care, and it's like you have to follow up with a specialist, and then sometimes they don't. So this kind of shortens that time. Have you guys done any studies to show the time to value or time to treatment? If let's say somebody has some abnormality with their heart or something and they have to see a specialist, have you guys done any studies like that?
We have. So it's different health system by health system. It is, but access has been an issue for years. And we have the ability to open up more access simply because of the throughput that virtual care offers. And now one of the advantages is visit resolution. Video visits or virtual care has a certain, call it 85, 90% visit resolution. But there's that 15 to 10% that say, you know what, you need to come in because I need to do this or I need to see this. When you have something like TytoCare, that visit resolution goes up to 98%. And so you're not using two spots. You're being more efficient with your time. You're taking that initial consultation and you're making it virtual so that you can have access to what's going into the offices, just for those things that absolutely are necessary. So our studies are vary health system by health system, but we are impacting access.
Got it. Not sure if you can answer this, but I'm going to ask it anyway. What's the most common used area for TytoCare? You know, on the patient side, like is a majority of usage coming from the heart, looking in the lungs, looking at the ear? Is there a specific area?
Yeah, we actually annually look at what is the number one diagnosis.
Oh yeah, give us a ranking.
Something like that. Obviously, looking inside the ear is a huge advantage. When you think of the journey of telehealth over the last 20 years, pediatricians were always skeptical. Hey, you know what, that's great for adults, but I need to look inside that child's ear. You now have the capability to do that. Cardiology, pulmonology, the ability to actually listen and see what's going on. We also have quite a few dermatology use cases because you have a derm cam that will then be able to capture that image, keep it in the patient's record, and then look at what the progress is.
Interesting. There's a lot of really interesting companies that are essentially taking software to take the skills of a specialist, put it into hardware, and then distribute it at scale. As an example, DermaSensor, a company that developed a great device, a piece of hardware that essentially uses AI to scan and detect skin cancer. Have you guys looked into partnerships with other companies, in areas that you guys probably may not specialize in? Have you guys considered that at all?
Sure, it's always up for consideration, but we ourselves last year at Vive announced that we received FDA clearance for our wheeze detection. So similar to what you're talking about, our stethoscope can listen for and detect very subtle wheezes that a pulmonologist would hear, but if you're a family medicine doc or a urgent care physician and not necessarily apt to hear those things, our wheeze detection will flag it to the provider and say, hey, we heard this, you may want to keep an eye on that.
When it gets flagged, how does the provider get notified? Is it via SMS or?
Well, it's within the patient's chart. So when they go into the Tyto exam for that patient, it'll comment that the wheeze has been detected and it's something you need to pay attention to.
How does this all work within the interoperability of like an EMR, for example?
Yeah, so another lesson learned from COVID is that integration is critical. You can't have disparate systems that you have to have multiple logins and I do this and I do that. That doesn't work.
It's making the problem worse, actually.
Absolutely.
Right?
And I think that also speaks to the adoption problem that we have in virtual care, is that if it's not integrated, so use the example of Epic, right? If it's not in hyperspace as a provider, I'm not going to go somewhere else out. That's going to add more time to my day. I'm not interested. So integration for us is critical. And we've been working with groups like Epic for a very long time to make sure that it feels seamless to the provider.
That's fantastic. Yeah, and I think, the one thing that people forget, I think we really experienced this in the last 10 years just with robotics, with AI, these LLMs, is that there's more and more tools to solve a problem. The problem is that they're creating a byproduct of problems themselves, and which is, physicians, nurses, they already have a lot to deal with, and adding one more thing for them to log in and look at something else that's making the problem worse. So that's great to hear. So I feel like the interoperability and integration side is not talked about enough,
We believe it's table stakes. You have to be integrated into the EHR.
100%. You've been at the company for some time now. What was one of the more difficult hurdles you saw for the company in terms of the technology and adoption? Because it is something that is very, very new and different for clinicians. But just from your perspective, just kind of curious.
Well, I think Tyto has been doing what they do for almost a decade. And we've obviously had some upgrades and improvements, but the concept has been there. I think the challenge that the organization had was that people just weren't ready to receive it. We were a little early. Maybe not early, but the masses were not necessarily comfortable with doing this virtually. I think a lot of people use the analogy of banking. Banking used to be you went into a branch for everything, and then ATMs, and then mobile banking, and then you take a picture of your check and it shows up in your bank account. And that progression, I think, is similar to the way we see healthcare and virtual care. Is it originates in you have to go in for everything, and then it'll eventually get to the point where you only go into a clinical setting unless it's absolutely necessary. And I think where Tyto fit well is as we made that leap we had to in COVID, and everybody said, okay, this is a thing, and there's the convenience to this and the ability to open up access, but how do we make it better? And that's where I believe Tyto fits.
For you and your team, this is a very interesting sell in terms of how you sell it and everything, but when you work with your sales team, what exactly is their call point, and what does that education and outreach kind of look like? And the reason why I ask is because we have a lot of traditional med device reps who listen to the show. They're very interested in these sort of new forms of med tech companies and everything. So like for you guys, like sales processes and business development, like what does that look like? How does that team structured?
Well, I think we have a very strong chief commercial officer who has kind of laid out a vision to say this is how we're going to sell a very complex deal. I think where the challenge is, we're not just selling a device. It's not a widget that says, hey, here you go, you're going to be able to hear heart and lungs. It has to be integrated. We have to understand what the ecosystem of that technology is for the health system. We have to understand who the patient cohort is. Who are they giving this device to? Does it make sense for them to have this device? How are they going to be reimbursed for it? Are they fee for service? Are they at risk in any capacity? So we take a very consultative approach to the sales simply because of how complex it is.
Got it. Looking forward in like 2024, what are some of the big goals that TytoCare has in terms of the clinical adoption rate and everything? If you think about the stereotypical bell curve for adoption, you guys are probably still in the beginning phases of that adoption curve. So how do you guys think about it in terms of pushing beyond just your early adopters?
Well, I think for us as an organization, getting everybody on board with Tyto, it is an easy conversation to have. To sell the idea of enhancing what virtual care is not that challenging. Where the next iteration of what Tyto is taking those customers who have already agreed that this is a great idea and seeing them really flourish. So we will obviously continue to bring on new organizations, but we really want to take the people that are with us and see them grow significantly. Because we obviously track utilization across the board, but we have metrics and targets with specific customers to say, you're here today and we want to get you here. How can we help you do that?
When it comes to that, I would imagine there's, I guess, different verticals that you guys commercialize through, but, do you still need to go through a clinical champion route where you find if you go to a new health system or something, you need to find a clinical champion who's going to champion the product and then go through administration in terms of adopting and distributing it? Or is it more of a multi-pronged approach where it's, there's clinical champion, maybe the CTO of a hospital? What does that look like?
Yeah, I think it's the latter. Previously, and again, I've been in virtual care for over a decade, you would talk to whoever the clinical leader was, get their buy-in, and then they would disseminate that message to everybody else. Where we're at today is there are new chief titles that have significant impact on decision-making within an organization. So that chief digital officer, that chief transformation officer, that chief technology officer, titles that are less than 5 or 7 years old, these are the people that we're really working towards to say, hey, we can help your organization change the way you deliver care. and we can do it in these ways, and this is how we're going to measure it. So I think multi-prong, go in talking to multiple people within the organization, but those transformation officers, those digital officers, those are the people that we're really having those conversations with.
It makes sense. I guess oftentimes are those former clinicians or no?
It's mixed.
It's a mix.
This is me personally, you have to have clinical buy-in.
Yeah,
So-
I think so. I think so too. I'm very big on that.
If the physicians and the providers are not bought in, it's never going to go anywhere. But I think they're more apt to adopt a digital solution if someone from the clinical space is bought in. So I think it's critical within the sale.
Got it. In the past, I guess, we always like to talk about sort of war stories and lessons learned. In the past when you're driving adoption, anytime you're trying to change a standard of care, it's very difficult. In the past, what have been some of the lessons learned from like health systems and prospects who said no, right?
Well, I would flip that a little bit and say we are to a position where someone wants to engage with us, but if they don't have the right pieces to be successful, and we know they're not going to be, we have to have that conversation with them.
What are some examples of somebody who wants to adopt and you say no, you're not set up for success?
It's never a no, but it's not right now.
Not right now.
Exactly.
Okay. Yeah.
You need to have that foundation within the organization. If you don't have a dedicated telehealth team, if you don't have consistent virtual care already provided, if it's not a key metric of your executive team, or if the system doesn't recognize virtual care as being a major contributor to success, that's going to put us at a challenge, at a deficit. So knowing that they have those fundamental pieces in place, it makes sense for us to move forward.
Interesting. I'm wondering with certain, so you guys mentioned you have your unit in Best Buy. So to go the consumer route, and compete with shelf space, that's a whole different world, right? Was that a decision that was made recently? Why did you guys decide to do that? And what was sort of the thesis behind that?
It predates me at Tyto, but the relationship with Best Buy, it goes back years. And I think it was the idea of, and again, this is pre-COVID, was that this is a technology and should be offered to everybody. Albeit direct-to-consumer makes a very, very small percentage of our sales, but it's there almost symbolically to say, as you're connected with everything else in your life, so should your healthcare.
Mm-hmm. On the consumer side, any learnings from that? Because that's kind of, I think that's very interesting, and the reason why I say that is that when you allow patients the opportunity to take advantage and take more control of their healthcare, it's kind of interesting to see what they do with it, right? So somebody buys the kit, you said it was $299, I believe, right?
Correct.
So they buy it, it's not connected to something. What usually does that patient end up doing with it? Do they take it? Like, has it ever happened where a new system starts to adopt Tyto because they say, hey, we actually have had a few patients who bought your kit and they keep asking, if they can use it,
There's very strong word of mouth, and I think that contributes to organizations reaching out to us. Again, the Best Buy play is more, not necessarily symbolic, but it's not a major vertical for us.
Right.
But it also helps with exposure. People see us there and ask their doctor. But I think it does speak to something that is a requirement, is that when you have it baked into a health system's care delivery model, it's much more successful than a standalone thing that is different than when you go talk to your PCP, or it's different when your son or daughter is sick. When it's integrated, I think that's really where it has impact.
Got it. In terms of the continuum of care and the different patients you guys serve, is the adoption of Tyto more so on the pediatric side? Is it more on the geriatric side? Neither, or is it more in the middle?
In the middle.
In the middle.
So, having done this for as long as I have, there used to be a very specific demographic that would use virtual care. Someone labeled them the alpha daughter.
The alpha daughter.
So it's a female, 35 to 45. She is the CMO of the house. She tells her husband what to do when he's sick. She's also the sister that all the siblings go to and say, what do I do with this? She's the woman whose parents call and say, how do I sign up for Medicare Part D? Like, she's the alpha daughter, and she influences the health decisions of like 15, 20 people. And so that female in that age group traditionally was the one who utilized telehealth the most because of the access and convenience that it provided. And we're still seeing that. So when we go to our customers and say, okay, demographically, what are you seeing utilization like? It usually ends up that you're going to find somewhere between 30 and 50 and 75% female.
That's fascinating. When it comes to exposure to the product, going to conferences and trade shows are really important. You guys are here at Vive. What are some medical conferences that clinicians? We have some clinicians who listen. Quite a lot of clinicians actually listen to the show. What conferences do you know off the top of your head that TytoCare is going to be exhibiting at this coming year?
We're here at Vive. We will be at HIMSS. We're doing some local, regional telehealth conferences, and then we'll plan to be at Health in the fall. We try to have impact regionally where we can, but we'll always have a presence at the national conferences.
Got it. With your current customers, you don't have to mention any names, but I'm wondering, like, what makes what is the makeup of sort of an ideal adopter of TytoCare when it comes to a hospital or healthcare system? Aside, you mentioned having a dedicated telehealth team is one thing, but I'm wondering if there's some other characteristics that kind of come to mind.
Well, we've all been saying as soon as fee-for-service dies, we can move on to value-based healthcare and all.
We'll see when that happens, man.
Well, that's the thing. I mean, it's been the same conversation for 15 years, right? But those health systems, those organizations that assume some risk, TytoCare makes a lot of sense because our solution will give that patient an alternative pathway to the emergency department, to urgent care, to even an office visit. And so if you're at risk in any capacity and you want to lower the total cost of care for each person that you're responsible for, have them stay home first. Have them connect to you where they are at first, and you'll see your cost drop significantly. So having that infrastructure of a telehealth team, having the understanding of how to properly market to individuals for engagement, but really those that assume some level of risk reap the most benefit from TytoCare.
I wonder, I don't know if you guys are able to measure this, but I feel like something happened during COVID. Maybe this was a slow-moving thing and COVID just kind of accelerated, but more people are taking advantage of their healthcare. There's an interest in your own health. So me as an example, and I'm not even an extreme example, I have a Whoop device that I wear. I have a continuous glucose monitor. I'm not diabetic. I just pay cash for it, right?
Yeah.
And so I mention this because other than that, I've heard in cases, even with surgery, certain patients, they go to, let's say, for a bariatric procedure or an orthopedic surgery procedure, and they go do cash pay with one physician, even though they have health insurance. I'm saying all this because concierge medicine is becoming more of a popular thing these days. Have you seen any adoption in those areas with concierge physicians and groups? I feel like this would be like a perfect thing.
It is, and we do see a lot of that. We have quite a few customers who offer membership-based healthcare, even direct primary care. We have a very large customer down in Texas who provides TytoCare with every member. It's just part of the subscription, and it truly, for a concierge program or a direct primary care, you already know what your revenue is because it's membership based. And so you're fitting in technology and things that are not only going to help your margin, but also keep that patient healthy. because if your patient or member is healthy, that benefits you. Right. So absolutely, that is a very good fit for TytoCare.
Perfect. And look, thanks for spending some time with us. Just to kind of wrap things out. For this year and moving forward, like any sort of teasers you can kind of give about TytoCare, some big areas that you guys are working on and looking to kind of expand into.
Well, so the buzzword of 2023 was AI, and I think that will probably continue, but we will further develop what we did in wheeze detection to other areas of our device. But I think you'll see us move from that episodic care to more chronic condition management. We're starting with asthma, but it'll continue to evolve from there. So when you look at Tyto in 2024, think just past that initial low acuity primary care.
Fantastic. Joe, thanks for coming on the show. I appreciate it. I'm your host, Omar M. Khateeb. This has been another episode of the State of MedTech. If you haven't already, make sure you hit subscribe. Give us 5 stars and write a review. We're the #1 show in the industry for a reason, because I always remind you guys to do that. We'll see you all next time. Thanks for checking out this episode. If you want to do me a big favor and join so many other people who have helped grow this podcast, take a second and look below. If you're on Apple, give us 5 stars and write a short review. If you're on Spotify, just give us 5 stars. And if you're on YouTube, hit the like button. And most importantly, if you can, subscribe. We release so many different episodes that you may miss. Be sure to subscribe and turn your notifications on. You get extra points with me if you subscribe across all 3 channels. Thank you so much. And if you felt like this episode helped you, send this to somebody who'd really enjoy and appreciate it. Share and spread the love. We'll see you all next time.